Good evening, ladies and gentlemen. I am Dr. Arun, consultant gastroenterologist, hepatologist, and interventional endoscopist. Today, I would like to discuss with you all an interesting entity and also a very important entity about this COVID-19 virus. In case if it is going to affect your gastrointestinal tract, what are the various complications? What are the various problems will you develop? For example, as we all well know that this COVID-19, also known as coronavirus, is predominantly a respiratory virus and it affects the lung, cough, cold, various respiratory symptoms, as we all well know that. But in case if it affects your GI tract, you may have nausea, which means an unpleasant sensation to vomit, and you may also develop vomiting like presentation, and also you may have severe abdominal pain and also a diffuse abdominal pain, which means you may have stomach ache which will be very persistent, and next to that you may have persistent loose stools also. This loose motion will be sometimes watery or sometimes maybe bloody. So if you are going to report these kind of symptoms, if you are going to take the previous data, almost around 20 to 30% of the population also been reported with this GI symptoms. So how to overcome this complication? That's the most important thing for me to discuss with you all. Always you need to wear a safe sanitation practice. You need to go on with the safe sanitation practices and do proper hand hygiene, and in case we are going to use toilet, flush the toilet properly and close the lid once after flushing and maintain a proper toilet hygiene. That's all the most important thing to prevent GI complication, because as we all well know that this virus will not enter only through the respiratory tract, and also it will be shedding in your stools also for up to 2 weeks of period, and you should be very cautious, because any viral event can affect you any part of your entire system. It can affect your gastrointestinal system, it can affect other organ systems also. So be cautious, do good sanitation practices, take good hydration, have a good fiber diet, and you need to take your good electrolyte drinks. That's the most important thing to prevent dehydration because of loose stools and other complications. If you're going to take all these things, and when you're going to harbor this COVID virus, it definitely you will be landing up with only mild to moderate presentation, and definitely very well you can overcome this complication successfully. Thanking you all for patient listening.